Hello everyone. In this video, I'm going to share with you all a very unique exercise that can be tried by the patients or performed by the physiotherapist to release the low back pain, which often arises more to the side or the flank of the low back, and it's not the central low back pain. Now, this low back pain can often arise from the dysfunction of an important muscle of the low back, which is the serratus posterior inferior muscle. This muscle originates from the spinous processes and attaches to the lower ribs. The action is to pull the ribs downwards and backwards, creating a rotation in the low back or the lumbar spine. The patient often comes to us in the OPD thinking that the pain is coming from their kidneys. So such patients can often mimic the pain which is coming from the kidney. So that is one of our differential diagnoses. But in majority of the mechanical pains, the serratus posterior inferior muscle dysfunction is one of the most common cause for this one-sided low back pain. So let's say this is the right side low back pain. So how to treat this condition? Bend the both knees of the patient, hold this position. Now ask the client to bend the elbows, grab the elbows using the hand. Now with the patient holding these two positions, hip and knee flexed, and both the hands anchoring the elbows, the therapist is going to just place one hand on the knees to stabilize them, and the other hand is going to be placed on the contralateral side elbow. So I'm treating the right side. So in that case, I'm placing my hand over the left elbow. Now remember the action of the serratus posterior inferior muscle, which is to rotate to the same side. So I am performing the action of the muscle by, just relax, by rotating him to the same side, but the patient has to resist this motion. So I'm going to pull you towards me, you have to resist. Okay, so hold this position, hold, good. Now again, patient is utilizing 20 to 30% of the force. Neither the patient is going to try and overwin the therapist's effort, and neither the therapist is going to try and overwin the patient's effort, because we want this effort to remain constant. And while holding this position for about 30 seconds, we are going to ask the patient to perform the deep exhalation motion. So just blow out the air, blow out while holding this position. Good, good. So serratus posterior inferior muscle also helps in deep inspiration. Therefore, we have also added the deep expiration motion during the performance of this exercise. And relax. While performing this maneuver for 30 seconds and repeating 2 to 3 times, we are going to find an immediate ease and release of the muscle on the right, which is going to help the patient in release and relief from the one-sided low back pain. Do add this exercise into your treatment regimes for one-sided low back pain and let us know your valuable feedback. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.